For an update on where we are in this country, let's catch up again with Professor Peter Collignon, who's the Professor of Infectious Diseases at ANU. He's joining us from Sydney this week. Good to speak to you again, Peter. And another update from the National Cabinet today. The Prime Minister openly talking about how we're doing better than expected, less than 20 cases a day across the country. I suppose one of the problems with this, though, is that we're starting to see some of these infections and tiny clusters of infections where the tracing has not been successful. The health authorities in various states are saying that it's a mystery to them as to where the infection has arisen from.
Well, that's true, and it's not necessarily a great surprise. I mean, I think we have to assume this infection is still with us. It's percolating below the surface, but every now and again it comes up. And particularly if it's in low level or even subclinical in a lot of people, it will pop up. And where we find it is when we get a cluster, be it a meatworks or something else. So I think this is unfortunately the new normal. Some people talk about elimination. New Zealand, even Victoria was talking about that before, but I think that's very unlikely. What we have done very successfully in Australia is not only flatten the curve, but we've turned it right down. But now that we're getting 10, 20 cases per day or, 150 cases to 200 per week, I think that unfortunately is where we're going to probably be stuck at, because that's not too dissimilar to, say, Korea, that was also successful. But what it means is we can easily get an outbreak, and particularly during winter when viruses are easier to transmit than during summer and autumn. So that's why we've got to keep up the physical distancing as much as possible, washing our hands, and particularly don't go to work if you're unwell or sick, because if you look at most of the clusters and outbreaks in Australia and elsewhere, it's often been somebody, often in their 20s or 30s, who've had a very mild illness, but they've gone to work, they're soldiered on, and they've spread it to lots of their colleagues, and in some cases, patients in nursing homes or hospitals even.
Yeah, that's why working from home and all that sort of thing might be around for many, many months to come. I think we could all see how easily the country could live with 10, 20, 30, 40 infections a day. But you talk about the risk of breakouts. There's just been one in South Korea, which they've slapped some more measures in to try and control. What level of infection across the country? I know it's a very general question because it might depend on a state or a city, but what level of infections, as we're starting to come out and open up the economy and society now, would worry you to the extent that we'd have to start reimposing some of the measures we're lifting off?
Well, I think we've got to expect between 150 to 200 cases per week in Australia, of which about 50% at least will be returned overseas travellers in quarantine. But if we start seeing 2 or 3 times that number, in other words, 300-400 cases per week in Australia, and we are seeing it predominantly in local transmission, that obviously is a concern. And if you look at what's both happening in Singapore, where they've had a big increase in cases, which was people crowded together in dormitories with their migrant workers, or in Korea, where it was when they opened their nightclubs and bars, it was just one person probably going there that caused over 100 other cases or even 200 cases. That's the sort of higher risk areas we've got to do all we can to minimise the chance that we'll get outbreaks in such situations. So we know what's more risky. It's being indoors compared to outdoors. We know it's more risky if you're shouting, singing, raising your voice, because droplets presumably go further. And we also know that if you're in crowded places with poor ventilation, that also increases the risk. We're not going to have zero risk, in my view, for the next couple of years. But we do know what to make the risk very low and get it right down from where it is. And that's doing the things that stop droplets being transmitted. And it means if you're working in a situation, for instance, where you can't keep away from people because you're an optometrist or something working close, that's where you need things like face shields, for instance, to protect your eyes, your nose and your mouth. So there's lots of things we can do that can protect us and protect others, but still allow us to work, one of which is working at home, 1 day a week if that's feasible, etc., staggering when we're on public transport, staggering on our opening and closing hours, because all that decreases our risk. It won't make it zero, but we're better off having a 90-fold decrease in risk if we can do things, particularly if they're not a big effort to do them.
Yeah, I think people are getting the message. Let's hope that discipline can stay in place. A lot of experts starting to say complacency could be our biggest weakness over the next couple of months.
Well, complacency could be. I mean, perversely, because we've been so good at controlling this, I think, and I actually think it's a problem in some of the states, Queensland, for instance, saying, almost they want to eliminate the virus. I think that's not likely feasible, but even if it was, it's so easy to reintroduce it.
Yeah.
So I think we're better off all assuming that the virus is there at really low levels, but we all have to persist with what we've been doing, particularly over winter, so that we don't let it come up, we don't get it, we don't give it to other people, and we keep clusters to a minimum because we're all doing the right thing at least 90% of the time.
Spot on. Thanks for joining us again, Peter.